We're going to explore today Tokusatsu syndrome. It is a Japanese discovered syndrome. What is this syndrome? It is called the stress cardiomyopathy. And that basically sums it up as stress caused heart attack. Being that it's Women's Month, March being Women's Month, Women's History Month, and this under-researched or very little known about condition, I thought it would be really nice for us to explore, to see how it has evolved, what is known about it, what are the symptoms, and how it is treated. So I'm looking today at, as you will see here, the New England Journal of Medicine. That is, there's a lot of publications about it. Not to say a lot, but there's a significant amount of publications about it. But I thought we should start with this one since it is a very well known and trusted journal of medicine. It was published on September 3rd, 2015. And let's see what it says about it. First, I think we should go back to the definition and then come back to this page as we have so much to go through. So let's go here. Oh, this is not where I want to be. Yes, so here, the European Heart Journal, the Oxford Academic, has also done a piece on it. But I feel like the introductory, to really understand this condition, it is best to look at this one first and then go back to the New England Journal of Medicine. And this one was published on May 29th, 2018. And it says here, Tokusatsu syndrome, TTS, is a poorly recognized heart disease that was initially regarded as benign condition, which is unharmless, well, pretty much harmless. Benign, that's what benign means. But recently, it has been shown that TTS may be associated with severe clinical complications, including death, that is prevalence, and its prevalence probably underestimated. I kid you not. This is real truth. It is underestimated because a lot of heart conditions and medical conditions that predominantly affect women are under-researched. And there is some bias in the research and data collection because usually the researchers are predominantly men and their research is skewed towards their own interest, which is more male-dominant challenge issues, medical problems as well. I would say is even the trials and research assessments, the candidates that are selected are predominantly men. And this is again evidence. I'm not giving you my opinion, but this is evidence that male-driven medical conditions that are in the forefront and women challenges and health concerns are put in the back burner. So we shall definitely, when they say its prevalence is probably underestimated, is definitely underestimated. That's my opinion. Moving forward, the current guidelines are, I'm just reading this because I just want to share this information with you. This is not my information or my opinion. This is actual research from the Oxford Academic European Heart Journal. And I will predominantly incline to do research that's based on the heart, brain, and circulatory and nervous system, because I feel like those are they're the main majority of the health elements that you'll see in the developed world, for the most part, are caused by those three categories, like those categories that I just mentioned. So what do we know? Let's look at the history, okay? Tokusatsu syndrome was first introduced by Saito Publications. There are 5 cases in the Japanese medical textbook in 1980. But after exploring, I found that it was predominantly, the cases started arising around 1983 in Hiroshima City Hospital. And I saw another article that also said that a little variation. It said 1985 was the first few cases that were documented, but this is where it happens. It was discovered in Japan, or documented in Japan. It's a global issue. It's not a demographic or racial issue, or none of that. It's affecting globally. It does not discriminate. Just like all illnesses do not discriminate for the most part. So Hiroshima City Hospital. So what happened in this particular assessment? There was a 64-year-old female present with acute chest pain consistent with acute myocardial infarctions. The ECG, the electrocardiographic, which is ECGs, they put on little taps on your chest and they check the waves of your heart. They saw nothing abnormal. They said normal coronary arteries, you see, because they're looking at the arteries and functions, everything was good. But later on, there was an unusual appearance of a left ventricle LV of narrowing the neck. So basically, the name Toku came from, in Japan, they used this device to fish, to net octopuses, and it looks like this. So what happens is that the heart normally would look like, but then at the bottom, the base of the heart would bloom out like here, in this where the cursor is right now, and that would be the condition. Like everything would be fine, but when they actually assessed it, they'd be like, "Oh, this woman's or this individual's heart is abnormally shaped," and it would sometimes go away, and some obviously would die from this. And it's not consistent with a traditional heart attack where there's no closed blockages in the arteries, right? So Toku syndrome gained international awareness among researchers and physicians, and the Wittgenstein. This is a reference at the bottom. So I will make this available, this article, the link, so that you could explore it in your own time. And it goes back to the New England Journal of Medicine. That's where we were at. So let's go back there, because I feel like that also gave it a much more understandable, easy to comprehend overview of the syndrome, where here it's predominantly data-based, and data is good, but if you can't fully understand and grasp what's going on, it's hard to digest it. So if we go back there, I think it was, where are you? I think it's this one. Yeah. The New England Journal of Medicine. And this one is 2015, but it was, the original publications was from 2005. So we know that so far. Okay. The International Toku Registry Consortium of 26 centers in Europe and the United States was established and investigated clinical features of prognostic predictors, the outcomes of Toku cardiomyopathy. Patients were compared with age, sex match patients who had acute coronary syndrome. So what we're learning here is that of the 1,750 patients that were assessed, 89 of them were women, which says this is predominantly women being affected, females. There were in the mean age of 68, but there probably are there are younger women, but this just happens to be the average. And a lot of times what they'll hear, which you'll read, is the emotion, what the cardiomyopathy was triggered by emotional triggers and were not as common as the physical triggers. This is, I don't know, I would say, considering the amount of articles and research I've done on this doesn't, it's not in line with that. It is predominantly, it is emotionally triggered. It's actually called the heartbreak syndrome. But here they're saying that emotional triggers were not as common as physical triggers. I would take that as a grain of salt, right? Because what we really want to know is here. This is predominantly affecting women. It is affecting women of a particular age group. For the most part, that's what they're saying. That's documented. It is under-researched. And also, it is triggered by severe emotional stress. But here it does not indicate that. It sort of balanced it out as saying that, well, the emotions were not as common as the physical triggers. Let me ask you a question. What would a 66.8-year-old woman be doing that's going to physically trigger her into a heart attack? I don't think she's running a marathon at that age. This is more of the later aspects of life where you're lessening your stress capacity, you're not running errands, like all the physically exertive activities you would be doing at a younger age kind of have ceased off. So that leads me to believe that this is a predominantly emotionally triggered syndrome, but it just does not say that. But in another article that I read, it said it was predominantly that. And we could go to that one. That one, I think I've saved it in my computer, which I will bring it up. Let me bring it up now, actually. So yeah, this one is from, let me show you. It is from 2007 Texas Heart Institute in Houston. This is what they did, okay? Okay, so in Japan, the tutsu means fishing pod trapping octopus. That is where it comes from. That's where the name was derived from. It's the shape of that, a fishing pod to trap octopuses. It looks like that. It's narrow at the top and it blooms out, where their heart was doing the same thing. Under assessment, it was the base of the heart had bloomed out, right? So that is what is it called here? Stress, cardiomyopathy, broken heart syndrome. You see what I'm saying? This is an emotionally triggered issue. This is not something that just happens because of poor diet or because of blockages in your arteries. This is happening because you are under severe stress and your body does not know what to do. So what it does is it attacks itself. And on this channel, what you will find is more and more of, as I go through the data, everything leans towards the stresses in your life that you are enduring will have profound, life-altering medical consequences. So be very cautious of the amount of toxic stress that you're taking on. And someone would say, yeah, I will definitely look out for the toxic stresses. But sometimes what we would consider a healthy stress, in fact, could be causing serious damage to our health. So I would say, for the most part, just reduce the level of stress in your life, positive and negative, however you want to define it. Stress, in essence, is not a positive thing. I don't know why they try to describe it as a bad stress, good stress. There's no such thing as either. Life is stressful. Life is hard. You do not need to compound it with unnecessary stress. Let's just leave it at that. So, girl, I'm just butchering this word. Tokutsuppu cardiomyopathy mimics acute coronary syndrome. It combined with reversible left ventricular. So basically, the apex, the bottom of the heart, blooming in the absence of geographical significant coronary artery stenosis. What did all that mean? Basically, it's just what I said, where your heart at the base of it blooms out. In this one, they did, you'll see here. You see what's happening here? The base of the heart is blooming out. Yeah, that's not healthy. That's not appropriate. It should not be happening. Yeah, so that is what we want to basically take away. All of this is just letting you know it's predominantly women that are predisposed or have life determinants that have put them in very stressful situations. So let's look at where does that say here. A 57-year-old Black woman, right? That's what it is. Of course, she has hypertension, all these things, which are, again, caused by stress. Like, they don't tell you that, but it's stress and poor life balance is what's causing a lot of these, what we would call first world illnesses. Another one, a black woman with history of diabetes. Diabetes is a slow killer in itself. And then add that with the stress and add that with everything else she's probably doing in her life. And guess what? You get this. Yeah. Where your ejection fraction became zero point 0.5 on an interval of pressure gradient. So it is not looking good. There was one white man here. See here, a 44-year-old white man who had pertained to medical history of underwent surgery. So he already had, I think, some other medical challenges. It's not to say that all of these people, this is what I would like to say. This is very deceiving to the naked eye, but I would like to just urge you to see things how I'm seeing things nowadays, where you're reading this. Look, let's take it from the beginning. Patient 1, 57-year-old black woman. Patient 2, 64-year-old black woman. Patient 3, 44-year-old white man. Patient 4, 64-year-old black woman. So what is the pattern here? The pattern here is this research, or this article, when the research was done, the individuals chosen for the trial or the research were already predisposed for this condition. Statistically speaking, black women have a higher stress, like their just level of stress compared to white women, or it's just higher. And then you look at that at a level of socioeconomic differences, right? Black women are more poor, more stressed, juggling more things in their life, just a lot of things is happening. It's like you wouldn't just say, oh, the hypertension, like for this example, for patient 1, a 57-year-old black woman with a history of hypertension. Hypertension, having a high blood pressure in her history did not predispose her to have this heart attack. The fact that she has high blood pressure is an indicator of something already, right? That's one thing. Something led to your high blood pressure. High blood pressure doesn't come out of nowhere. It's usually caused by severe stress, and a number of other things. Like we could explore that too. I'll do another video where we're exploring the okay, what I want to say is health determinants. That's what we're going to explore. We're going to explore the health determinants of hypertension, diabetes, all these slow killers, cancer. When you read everything, what you will find out that all of it goes back to stress, goes back to trauma, it goes back to childhood upbringing, it goes back to your socioeconomic positioning in life, it goes back to your health determinants, how you grew up, your gene, like you cannot escape intergenerational trauma. That's what I'm trying to say. Intergenerational trauma, even if you and your father and your mother did very well for you, and you were not in object poverty, like maybe they were, but you're out of it. The historic trauma is in your body, stored in your genes, stored within your subconscious. And as triggers in life, as you grow and explore as in adulthood, it will affect you. These things will come back because you're predisposed. It's like if you remember biology 101, I guess it could be university or high school, you remember dominant traits and recessive traits. Historic trauma, intergenerational trauma is a recessive trait. It's there, but it might not become a dominant trait, like a phenotypic. It might not have a phenotypic traits like show up in your life right away. But once you have a trigger, you get evicted, you lose your job, you go through a divorce, you lose a loved one. These triggers predispose you for those, what did we say? These recessive traits that were in your genes from intergenerational trauma will come back out. And sometimes the way they come back out is through mental health challenges. Your mental health is compromised. Anxiety, again, goes back to mental health. Anxiety, depression, diabetes, hypertension, cancer, you name it. Like everything sort of goes back to how stable your tree is. And when I say your tree, I mean your family tree. If you are from a family tree that has been uprooted, right, has experienced intensive generational trauma, you might have escaped it. Maybe you're not in that position. Like you might not. It could be the story of your grandmother. It could be the story of your great grandfather. But when you go down the line, when you see that, it should remind you to be more cautious of yourself because you are predisposed. I hope that like sunk in. You are predisposed to negative outcomes because you're genetically vulnerable. You're psychologically vulnerable because of what your ancestors endured. I hope that makes sense. So the reason I wanted to explore this article today is just because it really highlighted that for me. It highlighted the fact that you could be perfectly healthy. And when I say this article, I'm not talking about this specific one, like this one we're looking at right now from the Texas Heart Institute Journal. No, what we're looking at here. So I'll take you somewhere else. 1 second. Yeah, here. This is the one we were reading originally, I believe. Let's go back. No, we don't want that. There's another one that I saved. Is it this one? No. Let me go back to my folders here. I'm going to open it. Yeah, here. Let it open. Yeah, this is the one I want to share with you. It might be the same one. Yes, it is. Lord knew what I was thinking. So yeah, there's another one that I want to also explore with you. One moment. Do not go away. It is... No, we don't want that. We don't want this. Here, let me just go put it here. There's this girl that really put it so clearly. It was in... Yeah, I think it's in here. Yes, it is. I found it in the Heart Matters. It is an Australian, no, it's British. Let's go back here. Let's find out who they are. The British Heart Foundation. That's where I got it. I feel like this one really put it towards. So, what is Octopus Pot syndrome? As this nurse will tell you. She's a senior cardiac nurse, Emily Reeves, learned more about the condition from Dr. Dana Dawson, the cardiovascular medicine at the University of Aberdeen. Okay. So what causes it? So this is Octopus Pot syndrome. It usually occurs in people who have experienced intense emotional or physical stress. But in some cases, it's not identifiable trigger. You know why there's no identifiable trigger? Because when you've been in a state of toxicity and stress your whole life, you no longer identify it as abnormal. It becomes your new normal. So it's funny when they say that. There is no identifiable trigger. Of course, because it's your new normal. That's why you can't identify it. Exactly what is also no identified trigger. Exactly what causes it? Current scientific mystery. It's a kind of scientific mystery. I'm telling you, it's not a mystery. It's stress. That's what it is. Stress is causing it. Emotional burden. Yeah, between the heart muscles and the emotional signals, there is a huge correlation. And I think This, if you want to take away anything from this article, this is what we want to take away. Researchers are trying to understand the interconnection between the heart muscle and the emotional signals in the brain. They are trying to understand. And I'm telling you, there's not much to understand. You're a whole person. Everything is interconnected, and you're connected with everything out there. The environment, the world, the earth, like everything, you're affected. And if you need, I want you guys not to wait for researchers to tell you there is a link, because use your innate knowledge. Your innate knowledge will tell you there is a link, because how else can you explain seasonal depression syndrome? I get sad when it rains. I get depressed in the winter. You're being emotionally affected by the environment. That's what it says to me. Another one, my bones ache in the winter. Arthritis, they'll call it. And then what is the trigger? The environment. I have allergies in the spring. Again, you are affected by the environment. So just like these little things, these benign conditions that are tolerable in most people's lives, just inconveniences, they're not life-determining and direct killers, or but what it tells us is we are affected by our environment, by our circumstances, by our history. We are living beings, right? We are a part of the cycle of life and the cycle of everything. So I just find it so funny that they just say researchers are trying to understand the interaction. What a word to choose too. The interaction between the heart muscle and the emotional signals of the brain, or in the brain. Doesn't your innate knowledge tell you there's a connection? Not everything needs to be scientifically proven. Sometimes we just know. You know how your mind affects your body. And if you don't, I'm going to help you figure that out. And just understand that. Because once you understand that, how you approach people and how you approach your life will be different, because you're like, oh, I don't like this energy. This energy doesn't suit me. This whatever it is, wherever you're in, you'll either get positive feedback from the environment where you're like, yes, you're welcome. This is your place. Come closer. Come and spend more time here. Or you'll get the message of stop, retreat. Something about this does not feel safe. And that's this energy. You need to listen to those energies. I'm not trying to be woo-hoo-hoo. But have you ever seen how drained you become after an argument or after a fight? It physically drains you. Why? Because it affects your nervous system. And everything is ruled by your nervous system. Your fight, flight, and freeze capacity from your amygdala, the base of your brain. We'll leave it at that. The base of your brain. Amygdala. Yeah, some of us have issues. We know the words, but we just can't say the words. Yeah, so that is just sad. There's no research on how to treat it. Nobody knows when it's going to happen again. But what we know, we are emotionally affected. Let's stop this.